Our case today involves a 51-year-old woman attending her first screening mammogram as part of the NHS Breast Screening Programme. We're looking at standard bilateral two-view mammograms, which include the mediolateral oblique MLO and craniocaudal CC views. Let's walk through the findings, and I'll also bring in some potential questions that might come up during the viva. So, on both views, the first thing that stands out is that the breasts are composed of primarily fatty density, with residual glandular tissue symmetrically distributed in the central regions. This is pretty typical and not concerning in itself. But what's catching our attention here? You'll notice there are multiple well-defined rounded flecks of calcification scattered bilaterally. The big question here is, what do these calcifications mean? An examiner might ask, how would you describe these calcifications? These calcifications are smooth, larger than 1 millimeters, and benign in appearance, which is already reassuring. This type of calcification could be associated with plasma cell mastitis, fat necrosis, or even dilated acini within the lobules. What's important is the morphology. They're smooth, well-defined, and scattered symmetrically. Now, another possible follow-up might be, how would you differentiate between benign and malignant calcifications on a mammogram? In this case, we're not seeing any of the concerning features that would make us suspect malignancy. No microcalcifications, no pleomorphic or linear branching patterns, and no associated soft tissue mass, which would raise red flags for malignancy. The smooth, rounded nature of these calcifications points towards a benign process. The next natural question could be, what are the possible differential diagnoses for calcifications in the breast? Well, in this case, these findings are most consistent with benign breast calcification, which we classify as M2 under the NHS mammography reporting system. That means we're dealing with benign changes only, with no suspicious features to worry about. If you're asked about management, the answer is straightforward. No further investigation is necessary, and the patient will return to the routine screening program. A key point here is that any suspicious features would have triggered a different approach. Either further imaging, like magnified mammography, or possibly even a biopsy. But in this case, there's no need for such steps. An examiner might then shift gears and ask, what are the NHS screening guidelines? And what's the significance of this case being part of the breast screening program? The NHS Breast Screening Program invites women between 50 and 70 years old to undergo mammograms every 3 years. In this case, our patient is attending her first screening, which is part of the reason why the findings are benign and stable. The goal of screening is early detection, but it's important to note that in cases like these, with benign findings, over-investigation can be avoided, reducing patient anxiety and unnecessary procedures. Another question might be, how should the patient be followed up? Based on the findings, this patient will return to the regular screening program without any further action. If any changes occur in subsequent screenings, like an increase in the number or appearance of calcifications, then we'd reassess. But for now, everything looks benign and stable. One important aspect you might be asked about is the classification system. The NHS uses the M1 to M5 system, and in this case, these calcifications fall into the M2 category, benign changes only. For completeness, M1 represents normal findings, while M3 is for probably benign changes that still require further assessment. M4 is suspicious of malignancy, and M5 is malignant. In this case, we're firmly in the M2 category. Finally, an examiner might probe with, what are some of the common causes of benign calcifications in the breast? Calcifications like these are most commonly seen post-menopause, often associated with benign conditions like fibroadenomas, post-traumatic fat necrosis, or duct ectasia. In younger women, fibroadenomas can also present calcifications, but they tend to appear more coarse and popcorn-like. One final thought that might come up is about ongoing screening. Why is screening every 3 years adequate, and what's the benefit? The key here is that the NHS has determined that there's no significant difference in outcomes with more frequent screenings. The 3-year interval allows for early detection while minimizing unnecessary follow-up for benign conditions like this. So in summary, this case presents benign breast calcifications. The patient has nothing to worry about at this time and can return to the regular screening program. everything points towards a stable, benign process. And that wraps up today's case. If you're finding these discussions helpful and want more insights like this, don't forget to hit the subscribe button. Stay tuned for more cases, tips, and insights to help you prepare for your Radiology Viva. See you next time.